demanded the withdrawal of said Chinese vessels from Julian Felipe Reef, saying China is blatantly infringing on Philippine sovereignty and jurisdiction. But the Chinese envoy failed to acknowledge that this reef is part of the exclusive economic zone of the Philippines.
Chinese fishing vessels have been fishing in the area for many years. Now those vessels are taking shelter in the part of the, sea. I think it's a quite normal activity. There is no such militia vessel as claimed by some people. Any speculation is not helpful. Thank you.
The second batch of Sinovac vaccines donated by China has arrived in the country. The Philippines received 400,000 additional shots this morning, bringing our total Sinovac supply to 1 million. Government officials such as Health Secretary Francisco Duque and NTF COVID-19 Chief Implementer Vince Dizon personally welcomed the vaccine's arrival at the NAIA. They were also joined by Chinese Ambassador to the Philippines, Huang Xilian, who expressed hope that these donated shots would help the Philippines speed up its vaccination drive. This is the fourth batch of COVID-19 vaccines to arrive in the Philippines, including those from AstraZeneca. And the country is expecting to receive some 2 million more doses before the end of the month from both Sinovac and the COVAX facility. The government is also assuring the public that more supplies are on the way. The big number, 152 million. That's the volume of doses expected to be delivered by year-end, according to the latest report from vaccine czar Carlito Galvez. That includes 25 million doses of Sinovac. The private sector and local governments are also expecting 17 million AstraZeneca doses by May. Under secured agreements, the national government will bring in 13 million Moderna shots and another 7 million for the private sector. As for Novavax, 30 million doses were purchased, with the private sector and LGUs getting an additional 15 million. The government is also set to sign supply agreements for 5 million doses of Johnson & Johnson's vaccine and for 15 million doses of Gamaleya's. Negotiations are still underway for 25 million Pfizer doses. PAL spokesperson Harry Roque clarifies that President Duterte is not against the indemnification agreement, but only on blanket immunity covering willful neglect and gross negligence. Meanwhile, some senators are calling for the abolition of the IATF for what they call incompetence in procuring vaccines. Maricel Halili with the report.
Back in February, President Duterte signed into law Republic Act 11525 or the COVID-19 Vaccination Program Act. It expedites vaccine procurement and allots a 500 million peso indemnity fund should there be adverse effects from jabs. But in his address Monday night, the president seemed clueless about signing the measure.
The government cannot guarantee, much less give you an immune status na you are freed of any and all liability. Masyadong mataas na.
He even questioned the legality of spending government money to protect vaccine makers.
Gobyerno magbayad. I do not think that it will be legal. Sabi mo, it's illegal for us to do that. Ang makagawa lang yan is Congress. Wala nang iba.
Presidential spokesperson Harry Roque clarified the president is against blanket immunity, not the indemnification agreement.
Yung sinabi naman po ni Presidente na hindi naman po pwede na walang pananagutan ng pribadong sektor, ito po ay dahil nakasaad nga po sa batas natin na bagamat gobyerno magbabayad ng mga side effects, may dalawang exceptions po dito. Kung nagkaroon po ng tinatawag na willful neglect o yung tinatawag na gross negligence.
Vaccine czar Carlito Galvez admitted that the government has yet to seal its indemnity agreement with Pfizer.
May mga tinatawag tayong legal views ng Pfizer Group at saka yung ating legal. So sa ngayon, pinaplansya po yun.
But he said Pfizer is still committed to deliver 25 million doses. Given these issues, some senators called on the abolition of the Interagency Task Force, or IATF, for alleged incompetence with vaccine procurement. De Paula says the IATF is crucial for the pandemic response.
Ang IATF hindi po isang tao, hindi isang ahensya. Lahat po ng ahensya ng gobyerno pinagsama-sama. Napakadami pong talinong mga matatalinong Pilipino na nagsama-sama para nga po humanap ng solusyon.
For News 5, Maricel Halili, We Are One News.
If you test negative for COVID-19 immediately after getting exposed to a positive case, don't celebrate just yet, as you may have to check that again, as health professionals remind the public that it could take 5 days before PCR tests can detect the virus. Camille Samonte with the details.
The incubation period for COVID-19 takes 5 days in the human body. This is the time between a person's exposure to the virus and the onset of symptoms. The Health Professionals Alliance Against COVID-19 says it's important for anyone exposed to a COVID-19 patient to undergo the mandatory 14-day quarantine. HPAC explains it's possible for the first swab test to show negative results upon exposure. Patients may start showing symptoms after a few days and turn out positive for the virus.
Hindi po pwede na ika-cut short po natin yun. Dahil hindi po natin alam kung kailan po kayo magmamanifest ng signs and symptoms. 14 days po talaga. Kaya nga po ang problema, kung sa pang 10 araw kayo magka-symptoms, kasi ibig sabihin, a-absent pa kayo ng another 10 days. Kasi 10 days naman kayong i-isolate. Pagkatapos ng 10 araw po, kailangan po kayong magpa-assess muli sa inyong nurse o sa isang doktor para bigyan po kayo ng return to work clearance.
HPAC member Dr. Annalisa Onglim urges Filipinos to be more careful and to strictly follow health protocols as more countries are detecting variants of concern.
Kung nakakatakot na ang COVID nung simula, hindi ba mas nakakatakot lalo itong mga variants na ito? Well, dapat nating aminin, no? Dapat talaga siyang pag-ingatan ng husto. Kasi nakita na nga natin, dumami pa ang mga kaso. And sinasabi natin, dahil natuklasan na natin yung variant sa ating bansa, maaring may relasyon itong pagkalat ng variants dun sa mabilisang pagdami ng kaso.
The group says it's important for the public to follow apat dapat, especially now that we're seeing record-breaking daily COVID cases.
Kahit bagong virus variant, parehong pag-iwas, apat dapat pa rin. Ano ba ang apat dapat? Air circulation and ventilation, physical distancing, pagsuot palagi ng face mask at face shield, at ang oras ng interaction natin sa isa't isa.
Though vaccinations have started, the group says each Filipino has a responsibility in preventing the further transmission of the virus.
Yung bakuna po, with the ongoing surge, it will take time. Kaya po namin ini-emphasize ngayon yung apat dapat. Kasi po, kahit magpabakuna tayo ngayon, it will still take time bago po makarating sa ating mga baryo, sa ating mga kinalalagyan yung bakuna eh. Pero yung apat dapat, nandyan na ho siya, no?
For News 5, Camille Samonte, We Are One News.
We'll have more stories after this short break. Stay with us. You're still watching One News Now. I'm Charles Lejano. Due to the continuous spike in COVID-19 infections, some health experts say it's impossible to substantially bring down the reproduction number of the virus within 2 weeks of the NCR plus bubble. To help us further understand this issue, we have with us OCTA research team member, Professor Guido David. Good morning, Professor. Currently, we have the reproduction number of 2.1. Could you explain to us how bad is this? Right, I think you're on mute, Professor. All right, we'll try to circle back to Professor David later on.
Test. Hi, Charles.
And those are the top stories of the hour. Join us later at 1 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Register for a free account at www.signalplay.com so you can stream One News live anytime, anywhere. I'm Charles Lejano. Mask on, wash hands, stay safe, Philippines. We are One News.